Welcome to the Brilliant Board Review Podcast, your trusted source for high-yield board prep, CME, and the latest in clinical medicine.
Now let's talk about antihypertensive medications and fracture risk. This is a specific study done in the Veteran Affairs. I want you to always think when you see a Veteran Affairs study that's been done, they're usually done well, but also the board likes them. The board likes them because it usually finds a way of reducing costs. We're talking about antihypertensive medication initiated fracture risk in nursing home residents. This was 13,000 patients, and these patients were followed from years 2006 to 2019. And their average age was about 78 years old. And the primary outcome was composite of pelvic fracture, which we know that's end of times, surgically treated hip fracture, those can be end of times, and fracture of the humerus, radius, and all that require intervention 30 days after starting antihypertensive medications. So this is either a first antihypertensive medication or additional antihypertensive medication given to a patient, and these were the mean average was 78 years old. And guess what the results were? So the people that received new medication, 4.5 out of per 100 person years had falls. And these are serious falls that can be end of times versus 2.2 per 100 person years in the patients where no medication was initiated. Very, very important study that we need to think about before we start initiating new medications in nursing home patients. But if we're going to initiate them, sometimes we have to, we need to check it. We need to check for orthostatic blood pressure. Now, I know normally people check in about 2 minutes, blah, blah, blah. But a follow-up study, this was in 2023, this is New England Journal, and also noted that checking for people at risk for falls and older risk patients need to check orthostatic pressure between 3 and 6 minutes after standing. This is a better way to get a risk assessment for falls in these patients. This is what we need to check. It be 3.6, and the actual time was 4.5 was the median time that they found was effective in getting information to see if these patients were having orthostatic blood pressure. And this was a great way to tie into this. So if you're going to initiate it, you need to check for orthostatic blood pressure. And you need to do between 3 and 6 minutes after standing is when you're going to check those pressures.
Thanks for listening. Visit brilliantcourses.com to learn more and claim credits for this educational activity. See you next time.